Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So, as we know, we were discussing about uh, the breast milk feeding, the real challenge to a working mother. So, already we have completed two parts. So, I welcome you for the next part. Now, again, the question is in the last class also we have seen once the maternity leave is over, what next she has to do? The best option is she has to opt for EBM. So, EBM also gives the nutritional support, EBM also gives the emotional support, and mother also gets satisfied that she is able to feed her baby with her breast milk. Now, suppose when the mother is now ready to attend the work back, now what next? Now, one thing is before resuming to the work, half an hour before you can feed your baby. Okay, this is one of the way that you can do it. So, just half an hour before you are leaving the home, go for a complete feeding to your baby, and after coming back again go for another complete feeding. Okay, so this is one way out along with the breast EBM, ejected breast milk. Okay, expressed breast milk. Okay, so in your absence anyway you are giving express breast milk, but just before going out and immediately after coming inside the home, so you give one complete feed. Now when you are in the morning hours, when you are going out, so you are feeding your baby completely, isn't it? That time the breast milk also oozes from the opposite breast, another breast, right side breast, right or left sided breast. When you're feeding one side, from the other side usually the breast milk oozes out. You collect that breast milk and that can be also given to the baby in your absence. So if you don't have time to express the breast milk, this is one of the easiest way. Okay, maybe in the night hours when you are feeding, the breast milk is coming out from the opposite breast, another breast, not opposite breast, another right breast. So you can collect it and keep it in the fridge. We will explain how to collect and store it. So in between you go for EBM. So EBM is better to be given by cutlery spoon or glass. It should be collected in the glass bottles or any stainless steel vessels. Okay, and should be given by using paladi or using cutlery or the spoon, etc. Never use the bottles. Okay, plastic bottles or nipples should not be used to give it. Okay, so now again after coming back from your duty, again once again feed the baby. So then in between you substitute by top feed if you want. Okay, just I told in the last class, if the baby is taking it 6 feeds, so 3 feeds you substitute by the top feed and 3 feeds by the EBM. Now EBM at workplace. Now we come to the another important part. Okay, you have collected the EBM and kept it in the home, kept it in the refrigerator, and you told somebody to give it in your absence. But there is one more important thing is that you have to collect the EBM in your workplace also. So you can ask me how it is possible. See, there is one simple principle behind this. You should not leave the full breast as it, and you need to empty it oftenly. So in the working place, suppose 9 o'clock you are going, you are coming back at 5 o'clock, almost all 8 hours in between. So definitely your breast will be full again with the breast milk. And you keep this breast milk which is full breast milk in your breast as it is. If it is not utilized, that means if it is not expressed out, then that itself is a negative feedback phenomena. Reflex. That means when the breast milk which is produced by a lot of prolactin like hormones, okay, and it needs to be expressed by the hormones like oxytocin, etc. Now if it is not done, so that itself is a negative reflex for the stoppage of the breastfeeding. Okay, if you continue this for the so many days, naturally your breast milk production will be coming down. This is because of negative feedback mechanism. So even in the workplace also you have to express the breast milk. Then only you can have a good lactation, and for a long time, maybe up to years together, you can able to feed your baby. Otherwise, naturally what happens after 1 or 2 months, the amount of the breast milk which is produced from your breast will be get decreased. So this is another big problem. So in the workplace also you have to go for EBM. Okay, so at workplace, every 4 hourly or every 3 hourly, you have to remove your breast milk and you have to store it. Yes, in the workplace also. Okay, so now you can carry a ice pack or a carrier like substance, okay, where the ice cubes are kept and in between you are keeping the expressed breast milk. If refrigerator facility is there in the working place, you can keep it there also. But when you're bringing it to the home, okay, you have to keep it in the ice box. Okay, then immediately put it to the freezer in your home. Now, working place, usually you should have a private room. You should have a private room to express the breast milk. Now you have to talk to your employers or you have to talk to your manager, etc., priorly, and you should have a private room so that you can go and express the breast milk, and you can use some of the lunch breaks, tea breaks, coffee break, or in between some of the stretching breaks, etc. So in that time you can go and express the breast milk and you have to collect it. Okay, so this is very important. This collection is very important because to have a continuous prolonged breast milk production from your breast, you need to emptify it. When it is not utilized, naturally it is a reflex to stop the breast milk production. This should not happen. Okay, now how to store the expressed breast milk? How to store the expressed breast milk? In the last part again, suppose if your workplace is very near to home, suppose your workplace is very near to home, maybe 10 minutes or 5 minutes or 10 minutes. So then in the lunch breaks, you can come back to your home and feed the baby and then go. That's a very good option. Okay, if your office personnel or if your colleagues, they are ready to cooperate with you, so then just for it, if your workplace is very near to the home, maybe 10 minutes or 15 minutes, you can come in between and feed the baby, then you can go. Okay, this is very good option. Now, how to store the expressed breast milk? Usually the EBM is collected in a very clean vessel and you can store the collected EBM in the room temperature for 4 to 6 hours. In the top compartment of the refrigerator, it can be stored up to 5 to 7 days. See, it can be stored up to 5 to 7 days, and in the freezer, it can be stored up to 3 to 6 months. 3 to 6 months. Only thing is, when you are storing in the freezer and when it is used, it should be pre-warmed. That means you have to remove it 2 hours before itself and allow in the room temperature for 2 hours. Then it little warmed and then only it should be used. Okay, so if in the freezer before use you have to warm it on the warm water, that means take some amount of the warm water and just float the vessel which contain the EBM on it for 3 or 4 minutes, then it will be get warmed. You should not directly heat, you should not directly put on the microwave, or you should not directly boil it. Okay, so vessels which are used should be very clean, you should be sterilized. You can use a stainless steel or glass tubes, no plastic bottle, no feeding bottles at all, nipples, etc. Now to store it, milk bags are also available. It's not compulsory that you have to store in the vessel itself. Okay, small milk bags are available and you can store it in the milk bag also. And every time when you are storing and put it on the freezer or refrigerator, write the date and as well as the timings. That is very important because first stored breast milk should be removed first and the last stored should be removed at the end. Okay, so therefore writing the names and date, day and as well as date is very important, and also the timings. Suppose if you are giving this particular breast milk to the others also, other mother who is suffering from the same problem, then also this name, date, the date, timing is very important. Okay, or you can also put the numbers 1, 2, 3, 4 like that. Okay, so that the earlier one should be removed in the beginning. Now it is always better to store in the small bags. See, once you remove from the meal, once you remove from the refrigerator and it is used, then what is the remaining portion is there, that cannot be again refreezed. So it is a total waste. We can go on freezing, double freezing, triple freezing. This is not good. Okay, so once it is removed from the freezer and half it is used and rest of the portion has to be discarded. So therefore always better to store in the small bags or small bottles so that the wastage will be less. So if you want to carry this EBM, see, suppose you are traveling somewhere. In the traveling you feel very discomfort to feed your baby from the breast directly. Then you can use the EBM. Only thing is you have to carry the EBM in the ice packs and put it on the bottle, put it on the katori spoon or paladi, etc., and feed the baby. So okay, so this option is also not only for the working mothers, for all the mothers who are traveling. While traveling, if they feel it is quite difficult to feed, use a EBM. Okay, so this is also possible. Okay, now some of the things that you should not forget is, once the milk is frozen, breast milk is frozen, brought back to the normal temperature in within 2 hours, and then it should be used. And whatever the portion which is left back, it should not be reused. It should be discarded. If at all you are using it, it should be used within 1 or 2 hours. Okay, so milk which is stored will have slight different color. Now obviously this every mother should know. The milk which is stored will have slightly, suppose in the freezer you're storing for 1 month or 2 month, or maybe even in the 5 to 6 days you are storing the EBM, because of the storage and fat sedimentation and all. So milk, breast milk color will slightly change from the normal breast milk which is just expressed. And this does not suggest that milk is spoiled. Okay, breast milk is spoiled. It does not suggest there is a rancidification or spoiled breast milk. It is a normal one, and this should, every mother should know these particular facts. Okay, so even after starting the complementary feeding, we have to continue the mother's milk. Okay, now baby may be very much satisfied with the complementary feeding also, but even then you have to continue the breast milk.